Hi, good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health, Dayton, Montgomery County. Thank you for being here today. On behalf of Public Health, we welcome our speakers again, Mayor Nan Whaley from the City of Dayton, Mark Pompilio from the Community Blood Center, Sarah Hackenbrack from the Greater Dayton Area Hospital Association, and always a crowd favorite, Michael Doan, Medical Director at Public Health. So I'd just like to make an opening comment. My comments today are brief, but I would like to have our community recognize the work that our governor, lieutenant governor, and director of the Ohio Department of Health are doing to make sure that Ohio is a national leader in terms of responding to this pandemic in our state. Clearly, they are taking protective actions, making very difficult decisions, and we all need to recognize the tireless commitment that they're making to make sure that every Ohioan is protected to the degree possible. We heard today from the governor regarding some of the updates regarding SNAP and eligible participants being able to receive prepackaged food at a food bank. Obviously, some changes with the Bureau of Liquor Control allowing 2 prepackaged drinks per carryout. That will please many. He talked about congregate settings and the difficulty with nursing homes and other types of facilities, oftentimes housing some of our most at-risk populations, and the challenges that those have presented in terms of clusters of cases throughout the state, and we've all been made aware of those. And then obviously in terms of very difficult decisions being made, some of the changes regarding early release of inmates within prisons to reduce overcrowding. Lieutenant Governor Husted also gave us an update on the establishment of the Office of Small Business Relief to work with the 950,000 small businesses across the state, and there was a lot of other information presented as well. So we really appreciate the daily updates that we receive from state leadership. So in terms of the work that we do in this county to, quote, flatten the curve, I think it's, first of all, we've always talked about the work we're doing as response partners, but a lot of it is the work that individual citizens are doing as well. And so through public information and education, it's really the actions of our citizens that are making a difference in terms of flattening the curve. Yes, we continue to do our epidemiological contact tracing. So we identify ill individuals and we isolate those individuals. We attempt to identify close contacts and we quarantine or self-quarantine those individuals. The challenge is with that process, we will never know the true number of cases or the true number of infected individuals. We have community spread, we have limited testing ability. Many individuals show symptoms or do not show symptoms but can spread the virus. And a lot of individuals are simply ill and they self-care at home. So I think the take-home message from all that is, as an individual, assume that anyone you come in contact with may be infected with this virus. That's the brutal reality of what we're dealing with in this community, the state, and across the nation. Also, in terms of flattening the curve, without question, the work that our hospital systems are doing to be able to manage the expected surge in terms of bed capacity to care for those that may become ill as we move towards the peak of this pandemic in our state, which again is predicted to be near the end of April, early May time period. So clearly those actions, along with making sure that we enforce the stay-at-home order, and we realize the challenge that presents to our community. However, we are all making sacrifices. As individuals, we have a civic duty to comply with that order, not just to protect ourselves, but to protect others. And then obviously our public and private sectors also have a duty to comply with that order. So you saw many of us walk in today with these cloth face masks. Clearly, the CDC has updated their guidance and they're recommending that and encouraging individuals to wear a cloth mask when in certain public settings. The state of Ohio is also recommending that. Obviously, Public Health Dayton and Montgomery County is adhering to that advice as well as our response partners. As such, we demonstrate these masks. However, we need to understand that wearing a cloth mask does not alleviate the need for social distancing, so it's not a substitute for social distancing, nor does it prevent someone from contracting COVID-19 illness, all right? We wear these masks to slow the spread, especially if you're an ill individual. It would then minimize when you cough or sneeze and infecting someone else. So please understand, the cloth mask is one method of prevention in terms of spreading the disease to someone else, but it doesn't prevent you from becoming infected with the virus. There are a lot of videos out there. The Surgeon General has prepared one. CDC provides advice on making these masks. Just do a Google, YouTube search, and countless entities demonstrate how to make one of these masks. However, we want to make sure that we understand that the primary mechanism for preventing illness is not this cloth mask. So the best way to prevent illness is to make sure that we avoid being exposed to the virus. That's how we prevent illness. So we continue to do social distancing. We wash our hands. We cover our coughs and sneezes. We clean and disinfect frequently touched surfaces, and we obviously stay home when we're sick. So it's those actions that we all take as individuals and as a community to make sure that we continue to flatten this curve to where we all come out of this at the end and we're healthy and safe and we're thriving as a community. With that, I would like to introduce Mayor Nan Whaley to the podium.
Thank you, Commissioner Cooper, and appreciate your leadership, frankly, in this county for public health in Dayton-Montgomery County. If you look at the numbers across the state, Ohio is doing a great job thus far, but Montgomery County really is doing a terrific job, and I think it has a lot to do with the leadership that this community has, like Commissioner Cooper. So just want to make a couple of comments today. First, as Commissioner Cooper talked about, as we're wearing these masks, and supporting each other in them. They're uncomfortable, frankly, and warm, and not the most, there's a reason why we don't normally wear masks. They're not very fun to wear. I'll say this, as Commissioner Cooper has talked in the past about how we need to be kind and compassionate, the mask is really a way for us to be kind, because it's not that we're protecting ourselves from the virus, we're protecting others in case we're asymptomatic. So it's a way that you can be kind to others by wearing your mask, being kind to your community. The way you protect yourself is social distancing, not leaving your house unless it's absolutely necessary, making sure you're washing your hands regularly, and washing all surfaces. So think of the masks as an act of kindness, Dayton. That's what we're trying to do here. Secondly, we have, as Sarah Hackenbrack has, and Greater Dayton Area Hospital Association has done a great job of putting a mask, how to make one weeks ago. You can find that on my Facebook page as well as Gadaha's website. Very easy. As someone who does not sew, I was able to make 24 of them this weekend. It took me a long time because I'm not a seamstress, but still you can get them done. And I used their pattern. But at City Hall in the next few days, we will be having a collection site, because they have had for hospitals, but we have other frontline folks like bus drivers and other folks that we need to make sure have opportunities to be kind as well. And so we will be collecting those at City Hall. As you come into the first floor, you know City Hall is closed. There is that little lobby area. We'll have a box there so you can put them in, and then we'll distribute it to some of the folks that desperately need them in our community as well. So we'll be having that in the coming days. The city is hard at work, as the governor announced yesterday. The convention center is the surge site, and so we are working closely with National Guard in that effort. Hopefully the work that we've done has been so incredible that we won't need that site, but what we need you to do right now is not to let up. Just because our numbers are looking great and we're doing a great job at social distancing means we cannot stop. Keep the physical distance up, because this thing, as you can look at other communities that have had just 3 hours away from us, like Detroit, not very far away from us, this can be a beast if we let up. I am so proud of this community, so honored to be your mayor. Let's keep it up, stay home, and save lives. Thanks. Oh, and then I'll introduce, Yeah, Mark, because since we all are wearing masks. I'm going to introduce Mark Pompilio from the Community Blood Center. You know, a few weeks ago, I talked here about the importance of giving blood and donating blood, and went and did that. We're encouraging others to do that, but Mark has some specific details, and we certainly appreciate all the Community Blood Center does. Mark, come on up.
Good afternoon. Thank you, Mayor. I love the picture I have of the mayor donating because she's multitasking. She's on her cell phone, she's got a needle in her arm, she's doing the city's business and doing everything well, in addition to helping save lives. We've been talking about a lot about masks today, so I'll mention that it's been a concern of our donors about whether we're taking safeguards. We are. Masks are worn by all phlebotomists and everybody in our building downtown. We don't have masks for every donor. That hasn't been an ask, but it'd be hard for us to provide because you know how precious these are. But it was good advice on how to make your own. And we were taking people's temperatures before they even enter into the blood drive area, mobile or downtown, so that we can pre-screen someone right then and there for temperature and not have them enter into the area. I'll give you a quick update on our blood supply. It's strong. It's kind of a normal level. That's counterintuitive because of the fact that we are now up to over 100 blood drives canceled, representing close to 4,000 units, potential units to be collected that we've lost. Somehow that doesn't put us in a bad situation, only because the hospitals have drastically taken measures to cut back on blood use, and it's been because of the pandemic. That's good for now, but we don't know what's ahead. So we continue to ask people to consider donating. It is an essential activity for public health, and it must be done so that we're prepared for what the future holds. We don't know what will happen to donor health and their ability and availability as a donor. We don't know what will happen to hospital need. So we have to be prepared for that, and we ask people to make an appointment to donate, www.donortime.com, because that gives us a chance to have a very orderly setup at mobile blood drives where people are not congregating, where they're spaced apart, and where we don't over-collect on certain days for the blood we don't need, particularly right then and there. Keep people eligible, keep the supply flowing for down the road when we reach what may certainly be the peak of the infections. I think it's of interest today to talk about something called CCP. It's a COVID-19 convalescent plasma. It's a very different gift that someone can make than what we would look at as a normal plasma donation or a normal blood donation. This is not something for just any plasma donor to qualify for. This is a process of asking people who have been infected with COVID-19 and have tested positive for it and have recovered. They are either tested negative or they're a month's time past their last sign of symptoms. That person might be eligible to donate plasma for the CCP program that we're just kicking off. We're not launching it to the public just yet. It's steps away. But in the meantime, there was acute need right here in the community, which in a sense jump-started our program so that we put things into place to at least identify some donors that could possibly work for this. It was a difficult task. Our medical director, Dr. James Alexander, I give credit to him, but he credits the hospitals, all our partners, the community, for helping this work together and be able to at least get one person who was able on Monday afternoon to donate. His name is Menachem Mendel Mangel. He's the first former COVID-19 patient to donate CCP plasma in the Miami Valley region as we know it. He made that donation Monday. He's a 21-year-old son of Rabbi Menachem Mangel of the Chabad Lubavitch of Greater Dayton Synagogue. He lives in Brooklyn, New York. He was home visiting family in Oakland for Passover. He was tested positive for COVID-19 on March 18th. He was doing well as far as his recovery. His father learned about the idea of this plasma donation to help COVID patients. He learned about that from physicians that were members of his congregation who were very interested in getting something like this started in the community. The son says that there was really no debate about it. When he was eligible, he would do it. And he took another test for COVID-19 on Monday, was negative, and donated that afternoon. From his plasma donation, it was able to be divided into 3 units, all of which went to Miami Valley Hospital. I can't tell you who received it, just believe that it was someone of acute need with COVID-19, and it was well received, and it was very timely. The situation now is that we are going forward with finalizing through the FDA the steps to make this open to the public. That's essential because it was very difficult finding a match in this particular case. Menachem was a godsend, but we have to open it up to the public to find more people who would meet the criteria. I'll mention some of the criteria. It requires that you have a prognosis of COVID-19 documented by a lab test or a doctor's note. You have to have evidence of lack of infectivity through testing, or about 1 month has passed from complete resolution of symptoms. That needs to be documented. You have to meet all our current blood donation protocols, which means just as when you go to donate to give blood, as the mayor well knows, you have to pass certain screening, and those would all be in place. Not everyone can pass those things, so it's not come one, come all. But the physician must finally determine that they've met the criteria before we can make an appointment and try to get the actual donation of plasma into the process. I'd like to mention that Dr. Alexander said the entire community worked with great intensity and purpose to make this happen. In the end, we do what we do to help those that are in need, and through the efforts of a great many people, we're able to accomplish that task. We hope to establish a CCT program for the community soon. We will do everything possible to meet the needs of our community. Establishing it, dropping the flag on it, so to speak, would be when we have on our website a place where people can go, look at the criteria, open up a form, fill out that form, and then submit with the proper documentation. That's coming soon. I think Friday has been our goal. We hope to do it sooner, but we have a few hurdles remaining. In the meantime, we're getting calls. It's fine to inquire about it, and we give people information about eligibility. A reminder, it's not for everyone. It's not the common plasma donation. If nothing else is a qualifier, you have to have been COVID-19 positive at one time and tested for that. So finally, that'll be up and running soon. In the meantime, we want to remind people that we cannot have congregating at blood drives. People have to keep this physical distance. It's so important, and we can't have over collection. So please be patient, please be flexible with blood donations in general, and particularly with this program. If you feel you are someone that could help, that's wonderful. We need you, but due time, be patient, be flexible, and we'll have that information for you as soon as it's available about when we can open up to the public. I'll try to answer questions later about CBC's end of this, but the good doctor will also help with some of the details if you need them. Thanks.
Seems a little warm in here today. First of all, thank you, Mark, and thank you to the Community Blood Center for the invaluable work that you're doing to help our citizens. I'd like to also formally recognize Menachem for donating plasma. That's truly helpful to those most in need. And I think it's a nice reminder during this oftentimes dark period that it's a point of light, and it's a positive story. And it's a reminder that there are good people in every community that ultimately step up and do the right thing. Because I believe that the vast majority of us, our moral and ethical compasses always point true north. And this is a shining example of someone whose compass always points true north. So thank you. And with that, we'd like to welcome Sarah.
Thank you, Commissioner Cooper. Good afternoon. My name is Sarah Hockenbrock with the Greater Dayton Area Hospital Association. As we have talked several times before, our hospitals are actively collaborating and working together to prepare for the incoming surge that we're anticipating again later on this month. In the meantime, though, it is really important to understand and be aware that our hospitals are open and our emergency departments are open and ready to care for you in an emergency. Our region's emergency departments are safe and available, and it is so important that you do not delay emergency care if that is what you truly need. So if you have broken your bone, or if you're experiencing symptoms that make you believe you may be having heart trouble, it is so incredibly important to make sure that you get to one of the region's emergency department to seek the care that you need. There are processes and procedures that are in place that might be a little different than what you might have traditionally experienced, but those processes where we separate some patients based on asking them some screening questions are geared and built for your safety so that we can make sure that we are protecting all of the patients that come in through any part of our region's hospital, but particularly in our emergency department. I also want to share a special thank you to our friends at Emerson Technologies. They shared some pictures and a note with us today where they went and made a very large donation of 2,800 masks to our regional distribution site. And those were collected from Emerson Technologies around the region in their various offices. And it is just such a generous gift and a true spirit of the Dayton community. And we just wanted to share that and especially thank Emerson Technologies and their team as they took all of those donations to our regional drop site where we are using 945 South Edwin C. Moses Boulevard. You know that as the St. Vincent de Paul Center, and it is actually the loading dock in back for any businesses that are still interested and have unopened, unused types of personal protective equipment, masks, gowns, gloves, face shields. All of those things we are still actively collecting at that regional drop site so that we can distribute those not just to our region's hospitals, but those will go to our partners in nursing homes, skilled nursing facilities, as well as our first responders, that entire continuum of individuals who are really on the front lines of this. I also want to mention that yesterday Governor DeWine shared a little bit of information regarding our planning across the entire state regarding the development of alternate care sites. These are an incredibly important component of our surge capacity planning, but they're actually the last step in our community planning for preparing for the surge. We have spent the past month building up our internal surge capacity within our region's hospitals so that we can care for the majority of COVID-19 patients inside one of the healthcare facilities in this region. And so the alternate care site is one of the tools that we have available to us in the region should that surge come and should we need to move patients into an alternate facility. But again, our focus for the entire region is to care for anyone who is COVID-19 positive in our region's hospitals. And part of the ability to do that is dependent upon our partnerships at the local and state level. As I've mentioned earlier, we've recently welcomed in the partnership with the Ohio National Guard, and they have been fantastic in helping us look at the logistics and the operations planning to effectively make sure that we are maximizing any of the opportunities that we have through state and federal channels to get the much needed medical equipment and supplies that we need here in this region so that we can activate that internal surge capacity plan to its fullest extent. And so that partnership exists not just with the Ohio National Guard, but our partnership with Montgomery County Public Health, as well as Montgomery County EMA and our surrounding county EMAs, active, vital partnership to make sure that we are ready for what is coming. Thank you.
Thank you, Sarah. Now I'd like to welcome Dr. Michael Doan from Public Health, our medical director.
Good afternoon. I'm Dr. Michael Doan, Medical Director for Public Health, Dayton, Montgomery County. I just wanted to say a couple of things about what I saw in the press over the weekend. Antibody tests have now been approved by the Food and Drug Administration on an investigational drug protocol. The body, when we get germs, as it says here, germs or viruses, bacteria, viruses that invade our bodies, there are a variety of different ways that we fight those. We've got a chemical system that fights them. We have white cells of different types, white blood cells that will fight them. The other thing our bodies do is make antibodies. These antibodies make it easier for our bodies to, there's a lot of bodies. These antibodies make it easier for us to find and eliminate the bacteria and the viruses. So it's something that doesn't occur right away, takes a little bit of time. There are different types of antibodies that develop, and they can be developed at different times after an infection. The test that's out is looking for a very early antibody as well as a later antibody. Those antibodies serve as a way of saying that a person has had an infection and it's been significant enough that they made antibodies against it, okay? It does not necessarily diagnose an acute infection, because it may be that the antibodies are produced sometime after the infection. The other thing is that it was implied in some of the stories that finding those antibodies meant that you were immune and that you couldn't get COVID again. This isn't true. Nobody at the Centers for Disease Control and Prevention, the CDC, nobody at the National Institutes of Health has enough confidence that that's true that they've said that. So I think it's still kind of out of our ability to say whether you get immunity from that. We know that for the other 4 coronaviruses that we get for colds all the time, the common ones, you may get some immunity, it may last a couple of weeks, but you can get the same one again next year. So that it's still uncertain whether just finding those antibodies means you're immune. So if you've read something that implies that if you have antibodies, you're immune, nobody really is sure about that. So you still have to take the same precautions not to get infected again. I think that's really the only kind of take-home point about the antibody test. They're going to become more and more common. They're going to be something that people can get. They're going to be important as we move ahead. But at this point, they're just beginning to come into play. And so people getting those just realize it may mean that you've had that, if you have the antibodies, but it doesn't mean that you're protected from getting it again. Thank you. Oh, are there any questions?
Yeah, I have a question for, about the plasma. If you can kind of explain how it works and everything like that. Your turn, Mark. Oh, you gonna say it?
You want? Okay, so let's talk about antibodies, okay? So that if I had an infection, okay, my body produces antibodies. The way that those work is those have to circulate in my blood. They have to get into all the different tissues. They have to find the bacteria or the virus or whatever and attach to it so that my body can start to get rid of it, okay? Afterwards, if I still have those antibodies, they may have been useful for my body to get rid of whatever that infection was. If we take my blood and we take out the cells and we just have the liquid portion left, it's going to have those antibodies in it. And it's sort of like an antibody boost, if you will. If you give that then to someone else, that plasma will contain those antibodies and be useful. And this has been used in other diseases. This was used in Ebola in East Africa during the big outbreak. So that it's a well kind of worked out idea. How successful it will be with this infection is still uncertain. And that's why they're taking very careful precautions to make sure they know exactly what plasma they're getting and exactly what the reaction has been as they give it to people so that they can quickly figure out if this is really something helpful or not. Does that answer it? Okay. Not too much doctor talk in there?
Yeah.
Okay.
So is this treatment like considered experimental?
It's investigational. You know, everything, you know, penicillin was investigational at one point, okay? Everything is investigational until you get the studies that say it works. Nobody is going to try something that's investigational unless there's something, a history of other diseases or some kind of record that says that it's likely to work, okay? The questions are always, is it safe? Okay? Is it effective? The second part of that, is it effective, is the more difficult thing to figure out lots of times. And so it's safe. The question is it effective? And we need to figure that out so we don't spend a whole lot of effort and time trying to put in treatments that really don't work that well.
And I know it said you went to Miami Valley. Has it been effective on those patients that have?
I don't know about that.
You don't know.
And I wouldn't expect that we ever would know except in aggregate because, you know, they're patients, they're getting treated. That's between them and their doctors, and that information is protected.
What has to be done? What steps have to be done to open up the donations to the public?
Do you want to take that one?
What was the question again?
What steps have to be done to open up these donations to the public?
I can tell you that we at the Blood Center have had multiple steps required by the FDA to be ready for this. The simplest way I can put it is there are so many steps just to do a normal blood donation. Everything that puts this in place has to be the same type of measures and everything distinct from the other measures, so that there's a safe chain of command all the way through this process. But I think we're there on that. We're, I think, maybe a day, maybe more away of feeling that we are in full compliance with FDA is asking. And then the step for us, at the final step before implementation, is to be able to put on the website the criteria and the forms that someone can use to essentially apply, see if they are eligible, appropriate, and then have what paperwork and verification is needed. That's the good and orderly way to do it. I know we'll get phone calls. We don't want people showing up or something like that to donate, but we know the information will be out there and people will respond in different ways. So this hopefully will be the most orderly way to do it. And that's why we're waiting for that validation before we can say it's officially underway. It's a little contradictory in the fact that we've already drawn a patient. So I understand that. But this was a critical time and a critical need, and people coming forward saying, let's get this moving. And because of that, those things were able to happen to make Menachem be able to donate. But prior to that, there have been failures because the compliance just wasn't there. Enough days had not passed since last symptom. Wrong blood type, So that's why the criteria is everything. So we have to put that forward, get the right people to respond to it.
For people who've never donated plasma before, what do they need to know? What are the big differences between that and donating blood, and how long does it take?
First of all, it's what we call an automated donation. Some people know it as apheresis. It means that instead of what most people think of as a regular whole blood donation, where you come in and spend about 15 minutes maybe in the chair with a single needle in your arm, drawing blood through a tube to a PVC bag, and everything that flows into that bag is whole blood. It's all the components, plasma, red cells, white cells, and platelets. So in a plasma donation, you need a machine to draw the blood through a two-way needle so that it can go into a machine, bedside, right there, and spin the product, separating the components right then and there. Then everything other than the precise amount of plasma designated to be taken from the donor, everything else is returned through that two-way needle to the donor. So that process for plasma can take it does take longer than a whole blood donation. You're in the chair longer, and you could be there up to about an hour or so, approximately an hour for the typical donation. I'll mention that was a good-sized donation we had from Menachem. It was able to make 3 units, so that's a plus for someone who is able to give a large amount of plasma within the stipulations of how much. And so that is not a donation for everyone. Not everyone has experienced that. And I'll mention that generally speaking, people have done whole blood before they ever do an apheresis automated donation. But in this case, that is not a requirement. We know that we have a lot of people responding who've never given blood before, and they would be going directly to becoming an automated donor. So that's the gist of it. It's a different experience, but it will be something that will be new for a lot of people that try this.
I have a couple of questions for the mayor of Dayton. Mayor, my question is twofold. First and foremost, I know you're the first person to walk into a room and ask how everybody's doing. And some of the citizens, if not the majority of the citizens, want to know, how do you do it? You've been through a lot of all the mayors that we've had historically, from the 1913 flood and up until now. You are very resilient, and some people really want to know, how are you doing?
Well, that's very kind. Look, it's an honor to do this work, even through Dayton's toughest times and through unprecedented actions. I get a lot of energy from the people of Dayton doing the right thing. I think they are doing amazing work with this social distancing. It's very hard for people I know, but I am so proud of our community, and that keeps me going every day, knowing Dayton's grittiness and resilience. And so we're gonna get through this like everything else. Some of the city commissioners have called this, it's still 19 because it was COVID-19, and so once we get to the other side of this, we'll enjoy 2020.
And the second, thank you, Mayor. who are still concerned, what could have been, and I'm referring to Good Samaritan Hospital, if it was ever needed, it's now. And I know it's gone, we all know it's gone, but has there been any remorse that you have been made aware of on what's happened to the facility?
Well, certainly I've gotten lots of notes, both from folks about not only Good Samaritan, but also St. E's, right? And so, look, I think that we have to recognize, and I've said this on Twitter and other sources, that there are lots of issues with the healthcare system nationally. And when you go through a pandemic, you realize that hospitals do things to stay afloat, to make sure that they're okay, and there's pushes on that because of the system that we have. And when you're in the middle of a pandemic, quite frankly, it doesn't make any sense, you know, a lot of the different pieces of our healthcare system. One example is the fact that most of our healthcare had to furlough 40% of their workers because they're not doing elective surgeries. That's a huge part of the money they make to be able to do the other work. That doesn't really make any sense if you think about it when we so need our healthcare workers today. These are pushes that are far beyond Dayton and are really national concerns. And so what I've told folks is like, hey, let's focus on controlling what we can control right now, which is making sure that we take good care of ourselves, that we are the gritty, resilient city we are, and we will get to the other side of this, and then we will have a conversation about what does make sense on our healthcare system. But you know, there are lots of things that our partners are going through, and our joke is, okay, well, we'll just keep a list of that, but we have got to stay focused on what matters right now, and that's about saving lives by staying home. We control a lot more of this in our own homes than we think. We need to do the right thing. It is very difficult. And we know, just like we have the social determinants of health that public health talks about, that our communities that are poor, which is most of Dayton, this is harder for them than it is in any other part of the county. And we recognize that, and so we're constantly working with our partners in public health on ways that we can be helpful and what we can do to make sure that those people have ease. That's the work we're doing right now. We will debate and fight and claw for a better system on the other end after this is over. Thank you.
I think we have a caller. There's a little bit delay on the feed you're watching there, but caller, do we still have you on the line? We'll give him a second.
Yes, I'm still here.
Okay, did you have a question at all?
Well, I have a question about the businesses from last week. I noticed the website didn't update. It did, because you said that last week that I believe 12 businesses were issued the letters to cease and desist, and then there were only about 8 or 9 that were posted online.
So the question was, in terms of last week, we indicated there were 12, or we may have even said at one point 18 that we issued cease and desist orders to. As we've continued to gather information, we determined that some of those were in compliance. They were simply asking for additional information about how to do better social distancing. So we're in a process right now of updating all the information. We have gone through that initial list of businesses under investigation on our website, and I would say we are about halfway through that right now in terms of completing all the reviews of the information submitted. Our intention is, over the next day or so, that list we will have thoroughly vetted, and then we will have responded back to all of those businesses. And those that are deemed non-essential or that aren't complying with the social distancing requirements will receive a cease and desist order, and that will be placed on our website. The challenge becomes then, we will then add the next group of businesses where we've received complaints about, and that's about the same number. So we'll continue to do that and work through as expeditiously as possible, because I want the business community to understand we're trying to be very thorough, we want to make the right decision, and we're doing everything within our power to quickly resolve these, and those that are in compliance, we want them to come off the list. I'll give you an example, a couple of examples. We had a complaint about Yankee Trace Golf Course, and we've worked through with that entity, City of Centerville, and we've reviewed all of their information. and have deemed that they are in compliance and they're doing the social distancing requirements. I'll give you another one, and quite frankly, it's an example of how we're trying to be very transparent at Public Health. We received a complaint against the City of Dayton Finance Department. We didn't try to cover that up. We didn't try to address it separately. We placed it on the list, and Mayor Whaley has been here every day. We've done our investigation, and we've determined that that finance department is fully complying with the stay-at-home order and the social distancing requirements. So we're doing this, we're trying to be very proactive, get through this as quickly as possible, so expect an updated list within the next day or so, and it'll be on our website.